Hiya my darlings, happy Sunday, happy beautiful Sunday. You're welcome to another day, another episode of latest Nigerian mommy and daddy in town. Sit back, relax, and I will see you shortly. Yes, I'm happy to have you here. Are you an old subscriber? You're coming back. Thank you for coming. And are you a new subscriber? You're just joining us. It is so good to have you. Together with you guys, as you old subscribers know, we host this channel. And in fact, the topic that we're talking about today is something that you have brought to our table. So what are we talking about? We're talking about an offshoot from last week. We started talking about infertility and overcoming infertility last week, and we're talking about one of those disorders, infertility disorders in women. Which one do you think we're starting with first? If you said endometriosis, then you guessed right. We're going to be talking about endometriosis today, okay? Together with PCOS, polycystic ovarian syndrome, we said endometriosis is one of the main causes of infertility in the female, in women, and 1 in 10 women actually have it, so it is very common. It is responsible for 30 to 50% of infertility in women, so it's not something to be joked with. In more detail, right, endometriosis is actually life-threatening. So what is endometriosis? As we said last week, it is a disorder in which there is an overproduction of the hormone estradiol, which is a variation of estrogen, which is a female hormone. An overproduction of that hormone that causes the tissue that lines the uterus. You know, there's a uterus, fallopian tube, the ovary, and everything. It causes that tissue that is supposed to be inside the walls of the uterus to begin to grow on the outside of the uterus. Now, not only does it grow on the outside, it can also grow on the fallopian tube. It can grow on other parts of the reproductive systems of the woman. It can go as far as invading the pelvic area to touch the intestines of the woman and to touch the lungs and things like that. Left untreated, endometriosis is actually a very, very dangerous and life-threatening medical condition. So you want to know more about it. What do you think is the cause for it? If you're stating different things, that maybe obesity, etc., well, the cause is actually unknown. Like many of these medical conditions, we don't know why, but it is said that genetics may attribute to it. So if somebody in your lineage has had endometriosis, you may likely have endometriosis. It is also said that a weak or disfigured, or the word for, anyways, a weak immune system, can attribute to having endometriosis as well. What are the symptoms of endometriosis? Some of these symptoms may be similar to PCOS that we'll talk about next week, but they're just a few. Every other thing is similar. Some of the symptoms are bloating, as common as that is, yes. Bloating, heavy periods, having bleeding within your periods, like heavy periods, serious periods. Pelvic pain, especially during menstruation. Pain during intercourse. Pain when peeing or pooing. Okay? Sickness or a sickly feeling, when you're feeling sickly a lot of times. Feelings of fatigue, when you're tired, you're feeling fatigued, you're tired. All these symptoms and more, are attributed to endometriosis. How do you find out if you have endometriosis? If you have some of these symptoms and you're suspecting, oh, I think I have endometriosis, how do you find out? Okay, it's not something that is easily diagnosed, but some of the things that you can do if you visit a clinic, is they would have an MRI done on you. They will have an ultrasound scan done on you to check if you have it. A pelvic exam will be done to check if you have endometriosis, and finally laparoscopy, which is insertion of like a camera to see that area to check if things are happening the way they should or the way they shouldn't. Once a person has been diagnosed, yes, we're going short and simple. Once a person has been diagnosed with endometriosis, you will be placed on treatment if you allow, drugs to reduce, that estrogen. If it's very serious, they may suggest having surgery, and you may also be asked to change your diet, to help. So yeah, this is all that I think you need to know for now about endometriosis. If you have any other thing to add, you can add in the comment section below, and I look forward to hearing from you guys. Thank you for being here. Thank you for always. This is one of our short, sweet, simple talks, and I'll see you next week when we talk about PCOS. I love you. Bye.